For me, chiamo. Greetings to everybody. And then there are some for neighbor. Now, I think said the previous video we were talking about how to fix the country and all of these things, and I told you I love the show United Showbiz and Tino Michelle. Now, and some more bobo hono, then I will also sit down and analyze it and give my opinion about it. So the next one I watched was Christiana Wuni, Dr. Laiki, and Nama McBrown, and then another Samuel Bedu, and there were two guys among them, and Michelle T. And commodity na Nana McBrown ebusa say oh yes who Christiana Wuni ache and or see who Christiana Wuni, and that was when she went to take her vaccine, and who Christiana Wuni inti Christiana Wuni no say me so Sudana wo ye na de chi na me so me ye me fa me do na me call ye no asem ekosi wo ho ne say nurses for ne give me ID card no mo say me me age in intimate me enye den en wo pane na nyi se menye 60 and above na nyi so muntimi ma ne ho nti osi wo ye ya na obi tia girl back na no say nipa so me senior Christiana Wuni ni na osi man na wona wonka wo ba isenke ma wundi line na nka wo ba ya ne mu de nka protocol mu ne doctors ni aban mo jume kamu de protocol ba ma undi line so kwana nka wa ba be wo nti first one hono kakra bi na odi line so ayesi adentina na nka onni kwan so odi line so na nka so ba ya na ya wo no nipa afedi yeso onya 60 omuntimi nwo ne pane no afedi ye be wo no because o Christiana Wuni a celebrity na we no enyina corruption ne niema ekoso wo man ni mu a ye ka se we should fix ourselves no the fact we celebrating into nka on the line, which is okay. I mean yet say they are celebrated and all these kind of things into sometimes it's okay, so we do no munya protocol no munya first that na me problem ni say if mose onya 60 nti ontimi wo panen obey Christiana Wuni still onya 60 no ma wo ne panen. What if say ne kre onya 60 which is not true. I will explain how this vaccine works because me makowo me de I have say nti ma wo me de wa hanti no I know all the protocols. Me book ni wa hanu say the book for the COVID no I have it here. Sorry, it's here. I will get it and then I will show it to you guys, the protocols and in the what COVID-19 vaccine in there and you know they are corrupting the people or more even in this kind of things in the cry citizens ni area so in tinko kwa sampa unye 60 and what panie na oye Christiana Wuni nti mo che na tena se na ma woni pane na abre oba e mo se onya assistant pane no mo nye den mo won no nti ye den na afei de obeye Christiana Wuni de pane na afei de obetimi awo na ma woni pane no that's on the way nti no kun bia nka o maku maame ne kwa ko maku ni for no reason. Enti wakasa ni mu na wakasa fe do be mu say yi nkrofo feel line ni mu ase me man nkrofo kofie and all these kind of things and which means omunya system ya won pa na o sente all kind of kakosi say na omu cheche ni mu say obi o diabetes or wa komayare or long term disease ne sankofo ni ye omu na ye wo omu first omu na ye priority. That is not true. Enye ne kure say obi or long-term disease or way or muna priority no. Those type of people are supposed to see their doctors first to do a thorough body check. Ehunu say omo body no any yare na ewo omo ho, would the vaccine be able to work together? Vaccine no kwani body ni ebetimi aye dwenkofa problem bi amra ntimi nkun because so many people have died from this vaccine ewo ha among form more yari or more akuma say they didn't say it because there are certain things in the vaccine yari bi o na I really want to read it for everybody to know. Say whatever I'm saying, I'm talking based on evidence. Yes, so yeah, we give you this book. Then they ask you to read obe kind and yema ewo book nimunina. You have to read all before, and then you accept. Once you accept, you can see I take the box here. Box I take and it shows say my babe wopani and my first one. And I read it and I have understood to show much. I have read and understood all information as provided in the fact sheet and the statement of purpose of collection of personal data and then consent to the administration of vaccine. Or much running na then has say what you say and I will be wopani. Until furthermore na ya church who should take the vaccine and who shouldn't take the vaccine. So it reads Community is a vaccine used for preventing COVID-19 caused by SARS-CoV-2 virus. Community should not be given to this kind of people. Should not be given. Community should not be given. If you are allergic to previous dose of community or to the active substance of any of the other ingredients of the medicine, including the following: hydroxybutyl azanidine any de brofene susuntin ene muntie ni saa. So omakeka endru a ewo enema omode ye vaccine na ebem say we are allergic to all these things are untimi mfa. So you have to check whether you are allergic to all these things or you are not allergic to it. And sana wa wopane to know your advice see nko hu doctors first before you be wopane, unless would you who say unni body say onya yen diagnose you from any of these sickness, of these things to make the medicine affect you. That's number one. Warnings and precaution: talk to your doctor, pharmacist or nurse before you are giving the vaccine. If for or se me dance niwa ewa abrochiri me be kind ene wo ho no or say me the picture ebeka ho. I'll add the picture so people could read it and see. Or say you have ever had a severe allergic reaction or breathing problems after any other vaccine injection or after you were given Comirnaty in the past. You have ever fainted following any needle injection. You have a severe illness or infection with high fever. Vaccination should be delayed for individuals suffering from acute febrile diseases. You have a bleeding problem. You bruise easily, or you use a medicine to prevent blood clots, which happens in most women. Obabi or honoma or ubuninsana when they menstruate, it's flowing like crazy. Until a more mundra ombeno noma a best stop blood, 2 years, uncle for award this kind of problem. You should consult your doctor, your pharmacist, or your nurse before you take the vaccine. Intiminianum Ghana for Sir Christiana Wuni Trona Media, you go back to their interview, Nako TSA or sinners or more big diseases, no more priority or boa mensome boa. You have a weakened immune system because of a disease such as HIV infection or medicine such as corticosteroid that affects your immune system. If you have a weak immune system, you should see your doctor first. Now, obi your immune system, most of the symptoms is uye bibi kakra bi na wabre udidi kakra bi na wania ha bibi. There are those kind of things, Into immune system near weaker. bibia beka obody and say nobody share bia no na I take action. Or say children and adolescent community is not recommended for children aged under 16. Other medicines and community. Tell your doctor or pharmacist if you are have recently used or might use any other medicines or have recently received any other vaccine. Tis a panye no what will vaccine be? What the can call vaccine for bia who doctor. And or say would ya the what to a draw so you'll be a would there draw so be on every week, every 2 weeks be a hospital, different kind of sickness. And in draw beside nipa ya mutun draw so there are people with long-term diseases, diarrhea, serious diabetes, heart problem, hyperventilation is man oh what's our problem you also who doctor. And or say pregnancy and breastfeeding. COVID-19 vaccines are not routinely recommended during pregnancy unless the woman is considered at very high risk of SARS-CoV-2 exposure and subject to very high risk of COVID-19 complications. Intino mutie nsema make nyina. The vaccine contains less than 1 mmol potassium, 39 milligram per dose. That is to say essentially potassium free. This vaccine contains less than 1 mmol sodium, 23 milligram per dose. That is to say essentially sodium free. So it has containing potassium and sodium. And if you are driving, some of the effect of the vaccination mentioned in section 4 possible side effect may temporarily affect your ability to drive or use machines. Wait until these effects have worn off before you drive or use a machine. Intine yaka wa ha nyina na se wo nurse ni a yedo baba be gina se wo bi be wo vaccine unnim nipa kra fa vaccine no. You don't know the type of people that are supposed to take the vaccine and the type of people who are not supposed to take the vaccine. And I wo ni pane. So it doesn't really make any sense. So en nyansa bia en sheda anyede ennim. Enti se nipa ne ba na aha say yen aye wo pane no. Yen aye compulsory say yen wo pane no. 30 years and above. Any di kan yen compulsory. And I feel from 16 years upwards. Enti why na say when you're 60 years in Tipania Nienwo. Nanyam pennyfo nimpo na yare ne omunya ne kese. Mpennyfo no mu 60 plus no omu enenya yare no. Enti bia na mo percent pennyfo ni 64 no is 50. I don't know. Enti no, we have to be careful with what we do, what we say to people. That kind of it doesn't make any sense. Enti obi ti one ma was say aban